This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
It is Mon Health Talk for this Monday, March the 27th. I'm Kyle Wigg sitting in for Dave, and we'll hear from Dave a little bit later on this morning on WHAR. But we are privileged to be joined by Andrea McCarty. Andrea is a licensed, registered dietitian and certified diabetes care and education specialist with Mon Health Medical Center. And Andrea, good morning. Thanks for coming on with us.
Thank you. Good morning.
Let's start with your background and where you're from and what brought you to the Mon Health system.
Well, I grew up in Kentucky, but I've been in Morgantown most of my life, and I am a graduate of WVU and Marshall University and Rosalind Franklin University in Chicago. I came to Mon Health because I always wanted to be part of a community hospital. That's very important to me, serving a community, because my early years were in a very small town, and community is very important.
What type of training did you have to go through in order to get to this point where you could help people with diabetes care and with their diets?
Well, I have my bachelor's degree in human nutrition and foods and my master's in nutrition education, and then I also had to complete a dietetic internship, which is what I did through Marshall. And then to have that certified diabetes care and education specialist credential, a lot of time working with patients that have diabetes and then taking a lovely exam to qualify for that credential.
What drew you to this type of work?
There is some diabetes in my family, but I knew at an early age I wanted to help people through healthcare, and it was really important to me to help individuals with a chronic disease and teach them how important and quite possible it is to live healthy lives.
All right, let's discuss diabetes. It's a problem. I guess you could describe it as an epidemic even in this part of the country, in this state.
Yes.
What is it? What causes it? What are the different types of diabetes?
Well, some types of diabetes are preventable. That would be more of prediabetes and type 2. And there's also type 1 diabetes and gestational diabetes. Gestational is a high sugar initially found during a pregnancy. Type 1 is the type usually we see in children. It's more commonly diagnosed before the age of 30. Individuals with type 1 have to be on insulin for survival. Prediabetes is when the glucose is just slightly elevated but not high enough to diagnose type 2 diabetes. It's usually brought on by insulin resistance, and ways to reverse it, or I guess I should say prevent it, it's not really reversible, would be staying physically active and maintaining a healthy weight to reverse that insulin resistance.
Okay, so there's a type that you're born with, right, that children develop at sometimes a very young age?
To some degree, that would be type 1, yes.
Okay, and then you mentioned the type 2 is the more avoidable type with diet and exercise.
Right, and that type 2 diabetes makes up for about 90% or more of the people with diabetes are going to have type 2. So it is the much more common type. Typically, the older we get, the higher risk we are for developing diabetes, but we're seeing larger populations of even teenagers now developing type 2 diabetes.
And that's largely because of our diet, right? A lot of processed foods, a lot of, I guess, fast foods, and not enough fruits and vegetables.
To some degree, although diet specifically, or I should say diet directly, does not cause type 2 diabetes, but a diet that can contribute to being overweight puts you at a much greater risk for having diabetes. And then our lack of activity. We're not that active, and that's going to be a bigger factor, I think, for type 2.
Okay, if it's not food, if it's not the sugar, then what are the root causes?
Family history is a big issue. Getting older, one of the reasons we see more people now with diabetes is because we are less active and we are higher weight. Overweight and obesity is becoming a bigger and bigger issue, and we as a state, as a whole, we are one of only 2 states in the nation that have the highest incidence of obesity.
Okay. you say it's not reversible, but some of these things are preventable. So what are some mistakes people make, and what are some of the preventative methods?
The biggest, in my eyes as a registered dietitian, what I see a lot of people doing that doesn't lend well to losing weight and keeping it off is starting temporary diets. There are a lot of them out there, and they're highly effective, but they're not sustainable. And if you really want to prevent diabetes or decrease the likelihood you'll need medication to treat it, you need to find a plan that can help you lose weight and keep it off. Losing is easier than keeping it off is.
When we talk about diabetics, when we think about diabetes, you mentioned it once, insulin. That's the thing that, as you mentioned, type 1 diabetics need the insulin. It's essential. How many of the type 2 diabetics, what's the percentage there that rely on that insulin?
I don't have an exact percentage, but typically someone with type 2, the longer they have it, the greater the chance they will need insulin. And years ago, we used to say type 2 was the non-insulin dependent type of diabetes, but that's not the case. We do see many people with type 2 diabetes still need insulin.
Okay, what do you think's changed there?
As far as the need for insulin?
Yeah, you say that it's the non-insulin type of diabetes, but more and more of the type 2 need the insulin, correct?
Yes, and typically the longer you have diabetes, the more time there is for your pancreas to put out less and less insulin, something that normally didn't happen until we were over the age of 60 or 65. And in the time I've done this, and I've done this for 24 years now, we've seen the risk for developing diabetes on that risk test. It used to be, are you over age 60? Now it's, I believe last time I checked, it's now, are you over the age 40? Because we are seeing people at younger ages develop diabetes. So if you start with diabetes, say at age 35, then if we expect you to live till 75 or 80, there's a good chance your pancreas is not going to keep up and you will need insulin in your lifetime. So we're just seeing people at younger ages need insulin.
Mm-hmm. Okay, March is National Nutrition Month, and that's part of the reason we brought you on today is to talk about nutrition and how people can avoid some of these issues. Why is this so important? Why do people of all ages need to kind of, I guess, take stock or evaluate the type of foods they're eating in their diet?
There are so many health conditions that can be prevented, or many that can be treated by small changes to the food choices that we make. And that's where a registered dietitian nutritionist can come in and help guide people to make permanent food changes. It's a lifestyle change. It's not just, well, I'm going to give up sugar for Lent. It's more, I need to make changes that I can stick with forever.
Mm-hmm. It's tough.
Yes, it is.
In this society we live in, it's tough to give some of these things up because they're just in your face, and a lot of times you have to look real hard for different choices, right?
You do, and that's what I think my favorite message for every patient that I see is don't punish yourself for eating a food you've labeled as bad. There are no good or bad foods. All foods fit, and that's an important message for people to know for healthy eating. It takes the guilt away from some foods. Of course, there's healthier foods and less healthy foods, but there are no bad foods out there.
Right, it's moderation. Right?
Exactly.
It's eat what you should eat. You can eat maybe a little bit of what you enjoy eating.
Correct.
Okay, so you offer, well, let's go there. What type of services do you offer for people that want to make a change, or quite frankly have to make a change, just flat out have to do it because of their health?
We have 3 different programs offered out of this department: the Diabetes Self-Management Education Program, the National Diabetes Prevention Program for people with prediabetes or at risk for developing diabetes. Then we also have medical nutrition therapy, which is one-on-one visits with a registered dietitian for a number of diagnoses.
Okay, how do people get involved if they're interested in this?
There are a few different ways. They can call directly to the office, or they can also, we have to have a physician referral to see all of our patients, and if they call directly, we can get that from their provider, or they can ask their provider to refer them to a registered dietitian.
Okay, 304-598-1805, is that the correct number?
It is.
Okay, so let's start there. again, you need a referral from your primary care physician in order to be seen by someone like Andrea, who's a licensed registered dietitian. Andrea, you talked earlier about some small choices. Now, I know people that have serious problems need to come see you, but let's talk about some of these small choices that people can make to help their health and just feel better.
Even though I am a registered dietitian, I still feel like one of the most impactful things someone can do is move more. If they're physically able to be active, that doesn't mean they have to train for a marathon, but just moving more and sitting less would be a great start. And then as far as the food is concerned, pay attention to how many fruits and vegetables you get in a day. And if you find yourself getting none most days, try and add one a day until you get up to at least 5 a day. But just pay attention to that. Most of us, we go through a day without thinking twice if we've had fruits or vegetables. But paying attention to how many fruits and vegetables you get is a great start to getting healthy eating it.
Okay, so if you're not having any, then start with what? A banana or an apple or an orange.
Yeah, and fresh fruits and vegetables, they're not overly expensive if you get what's in season, or you even could grow them in your own garden for those that have that. But it comes in its own packaging. Most of it requires very little prep. An apple, banana, pear, clementine, something. And it is better to eat your fruits and vegetables than it is to drink them.
Okay. And in terms of vegetables, there's so many more options out there. I mean, it's endless. Yes. So there's bound to be something out there that tastes good to you, right?
Right. The most common snacking vegetable that I see people like, baby carrots are pretty common. Also the little cherry tomatoes, and some other people might like broccoli, cauliflower, celery, those types of things. But find one. If you need to put it in a dip, put it in a dip, but it's a vegetable. It's better than going without. Right,
and it's better. A piece of broccoli or a carrot and a little bit of a dip is better than a candy bar any day.
Yes, it is.
Or a bag of chips.
Yes, it is.
Okay, very good. What are some other changes, people? First of all, are vegetables, are they better for you cooked or raw, or does that matter?
If I'm comparing it no vegetables to cooked or raw, I'm going to say any vegetable is better than no vegetable. You're going to get more nutrients from the raw version, but I don't like to tell anyone that, because I don't want anyone to think, let that deter them from eating vegetables at all. Any vegetable is better than none. But fresh is fine. Steamed is a very, very close second. Canned vegetables would be on the bottom end of what's best. But you can also, if you want a cooked vegetable, those frozen vegetables that are in the steam bags, you just throw them in the microwave, push the buttons, and you're good to go.
Okay, so those would be better than canned vegetables,
yes.
But canned vegetables are better than no vegetables.
Yes.
Okay, and it's okay to prepare them with a little bit of seasoning maybe. I mean, you don't want to load them up with salt, certainly, right. But a little bit of seasoning's okay.
Yes, and if you do the frozen, get them without seasoning and then add your own. You have better control over how much salt you've added that way. But yeah, season them yourself and try different ways to season them, ways that don't add a lot of salt or a lot of fat. I have seen individuals, they're used to having their vegetables loaded with salt, and then they finally eat them without salt, and they say, wow, this doesn't taste bad at all, but they'd never tasted them before.
That's interesting. One more thing before we take our first break here. The way you eat your foods, I guess the order you eat your foods can make a difference, right?
You can, but there's no hard and fast rule that you have to do it that way. It's more personal preference. I like to encourage individuals to make sure you don't save those vegetables for last. I think that might be what you're implying. So, okay. Oh, no, I'm full and I can't finish that. Says the mother who tells her 8-year-old this all the time. You do need to make sure you eat everything on the plate.
All right, so pretty simple. Just eat the vegetables. Eat them. Eat the fruits and vegetables. Very good. We are with Andrea McCarty. She's a licensed registered dietitian and certified diabetes care education specialist with Mon Health Medical Center. We'll take a quick break. We'll continue the conversation coming up after this. This is Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Wednesday morning on WAJR. Our guest this morning, Andrea McCarty, licensed registered dietitian and certified diabetes care and education specialist with Mon Health Medical Center. We're talking about good diets and things you can do to maybe prevent diabetes or help yourself along if you are a diabetic. And Andrea, thanks for coming on. We appreciate it. Good morning once again.
Thanks for having me.
What would you define? Everybody's different, and I know if people need counseling services, they can give you a call at 598-1805. But what constitutes a good diet in your mind?
A good diet is one that is not cost prohibitive, one that you can afford, and also one that you can do for the rest of your life. Because the purpose of a good diet is to help you make healthier choices, and if you're only doing that temporarily, there's really no point in making any change at all. So you need to be able to afford it, and you need to be able to follow it forever. So if it's one of those diets that requires a lot of meal prep time and you're cooking all of these things, or you're eliminating large food groups, then it's probably not going to be sustainable forever.
Mm-hmm. We've talked specifically about diabetes, but what if you make some subtle changes, some good changes, and begin eating healthier, what other benefits does that provide to you?
Healthier food choices can lead to weight loss for many. Can also lower blood pressure for those that have high blood pressure. It also could improve cholesterol levels as well.
Mm-hmm. And again, those are three pretty significant issues as people get older. You talked earlier about the type 1 diabetes and how they are reliant on their insulin. In terms of the insulin and the cost, that can be a problem with some. Have you seen some progress in that in terms of the cost of medication that diabetics rely on?
I have seen some progress. It's been a long time since I've had someone that cannot afford their insulin. I think in the diabetes space, one of the biggest challenges we're having right now is not as much affording it, but the drug shortage with Ozempic, because Ozempic is quickly becoming a very popular and effective drug for patients with diabetes, but they're having a hard time getting it.
That's interesting. So I guess, for lack of a better word, the technology or the formula for the insulin has improved in some ways?
Right, it has. In years ago, when I first started my career, you were much higher risk for having a low blood sugar, dependent on when you dosed your insulin with the insulins available to us. But over the years, we've really gotten much better with the insulin available. There are some that are very low risk of causing a low blood sugar, and that insulin typically is dosed only once a day to cover you for the whole day, where years ago we didn't have anything like that. The best we had was a 2 times a day insulin.
Okay, so of the patients you work with, do you see people that are reliant on insulin and they can work their way back from that? Is that a possibility? Someone that's reliant on the insulin, if they make these changes in their diet and their exercise, they can kind of get away from that?
I'm of the belief that I will say never say never, but in my experience, when I see patients on insulin, it's highly unlikely they will come completely off of it, but it is not impossible to. It's just not. I don't typically see that very often. In extreme cases where they're losing incredibly large amounts of weight, we may see them be able to come off of some or maybe even all of their insulin. And that's in the type 2 diabetes space. With type 1, that is not a possibility.
Mm-hmm. Okay. Very good. Some final thoughts here. What can you say to encourage people to make some changes and to overall, strive to be healthier?
The first thing is, with food, there are no good or bad foods, don't punish yourself for eating something you feel is unhealthy. Just have a smaller portion of it and do it less often. Start incorporating those fruits and vegetables in. Be physically active and give yourself some grace when it comes to your food choices. A lot of times it's not just that we don't do fruits and vegetables. Our portion sizes are much larger than they need to be. Most would be surprised if they tried to eat less, that they're likely still going to be satisfied with eating a smaller amount.
Very interesting. And again, you don't have to give up your favorite foods. It's about moderation and maybe adding some other things in. Those fruits and vegetables are crucial.
Yes. You don't have to give up. If the only reason to give up a favorite food is if something like a food allergy is discovered or other type of intolerances where eating that food actually could be a problem, but those aren't common.
Mm-hmm. Okay, and with the fruits and vegetables, you say, about 5 servings? That seems to be optimal?
5 would be the minimal amount. Ideally, it's supposed to be 8, but if we can just get everybody to 5, that would be perfect.
Yeah, we'll
go with it.
If you don't have any now, if you don't eat it all now, 1 is good, and then work your way up, and we're shooting for 5 servings of fruits and vegetables. And I think if you get to 5, you're going to find something that you really, really like, and you're probably going to want to eat more of it, right?
Exactly.
All right, very good. Great information. Andrea, we appreciate your time. And again, how can people get in touch with you if they're interested?
They can always go to monhealth.com, or they can call me at 304-598-1805.
All right, Andrea McCarty, licensed registered dietitian, certified diabetes care and education specialist with Mon Health Talk. Great information. Thanks for coming on.
Thanks for having me.
That is Mon Health Talk Radio for this Monday on WAJR.